All right, welcome back to Beyond the Cradle. My name is Titilayo Oniso, and we've been doing what we can to give you little insights here and there onto what to expect now that you've found out that you're pregnant. Now, one of the things that happens most commonly is you start to hear so many old wives' tales and myths. Now, those myths can be daunting. Here are some of those myths, popular myths about the first trimester. For those that don't know what a first trimester means, it's basically the first 3 months of pregnancy. All right, so the first most common myth of the first trimester is you shouldn't exercise during the first trimester. Now, this is not exactly true. In fact, exercise during pregnancy is generally considered safe and even recommended by many healthcare professionals. However, it's important to talk to your doctor, midwife, any healthcare professional about the types of exercise that are safe for you and your baby. The second myth is morning sickness only happens in the morning. Now, despite the name morning sickness, it can happen at any time of the day or night. It's a very common symptom of early pregnancy and affects many women. But the severity and timing of the symptoms can vary from person to person. The third myth you should look out for is that you should eat for two in the first trimester. Now, while it's important to eat a healthy and balanced diet during pregnancy, you don't actually need to eat twice as much food as you did before. In fact, overeating can lead to excessive weight gain and other health problems for you and your baby. Myth number 4 is that you can't drink any caffeine during the first trimester. Now, some medical professionals say moderate caffeine intake up to maybe 200 milligrams per day or about 1 12-ounce cup of coffee is generally considered safe during pregnancy. However, it's important to talk to your healthcare professional, doctor, midwife, nurse, or a trusted friend in the space about your individual caffeine intake, especially if you're like me and can take quite a few cups of coffee in a day. Now, there is caffeine found in many soft drinks. There is caffeine found in chocolate. There is caffeine found in many different types of sweets and other foods. So an accumulation of caffeine from many different sources can become a challenge. All right then, myth number 5. You'll start showing right away in the first trimester. Now, some women say they start to show a bump early on. Many women don't start showing until later in pregnancy. This is normal. It doesn't necessarily mean anything, but hey, when you show, it's just about you and your body. Whenever it's time, it will show. Myth number 6 is that you can't dye your hair during the first trimester. Now, some experts recommend avoiding hair dye during pregnancy. Now, there isn't really enough evidence to suggest that it's harmful to the baby, but it is important to choose hair dye that doesn't contain harsh chemicals. And of course, follow the manufacturer's instructions carefully. Myth number 7 is that you can't travel during the first trimester. Well, myself and my kids, we did quite a bit of traveling in my time, and we didn't have any issues. But then again, it does differ from person to person. Travel is generally safe during the first trimester as long as you take precautions. Listen to your body. However, it is important, of course, as I say all the time, to consult a midwife, healthcare professional before travel plans. And of course, avoid destinations with high-risk diseases or health concerns. Myth number 8 is that you shouldn't take any medication during the first trimester. While some medication can be harmful during pregnancy, there are many safe options that can help manage symptoms or conditions. It's important to talk to your doctor or midwife whenever making these decisions about medication and certain supplements. Myth number 9 is that you should avoid intercourse during the first trimester. Now, this is a very debatable conversation. As sex is generally safe during pregnancy, there are some women who find it off-putting. Some women actually say that it makes them nauseous. Some women say they feel discomfort. It's all about listening to your body and understanding what your body wants, what your body needs during the period, and of course, having a conversation with your partner. If you've had complications in the past with intercourse during pregnancy, we would, of course, suggest one more time that you should speak to a healthcare professional. Especially if for any reason you notice any bleeding during intercourse, during sex, it could be a sign that your body is talking to you. Speak to your medical professional about that as well. Myth number 10 is that you could have a miscarriage if you have any spotting or signs of bleeding during your first trimester. Now, spotting is considered quite common. There are statistics that show that it happens to many different women. It doesn't always mean something is wrong, but you need to make sure that you speak to your doctor or healthcare provider if you experience any bleeding or spotting, as it could be a sign of something more serious. In summary, discovering that you're pregnant can be a life-changing experience filled with a range of emotions and physical changes. It's important to take really good care of yourself and seek medical guidance to ensure a healthy pregnancy and delivery. With proper care, attention, you can look forward to a happy and healthy pregnancy with the joy of welcoming a brand new life into the world.